Peter, good
Jerry,
to see you.
nice to see you.
I should be hugging you. He's my old cousin.
That's right, exactly. So you've, you'd like to know a bit about how this has been working, and you know a bit about the physiology already of how laser therapy works.
Yeah, well, people ask me what is it doing, and I really don't understand the technicality of it all, but
Okay.
it's working. I'm feeling good. I'm going fishing. Yeah, it's.
Well, the theory is that class 3 laser, and there's a number of lasers, but we're dealing with right now is low intensity laser therapy. It's called LILT. And it helps to improve right away when we're actually shining this through the chest wall. It helps to improve the nitric oxide within the deep tissue structures right away. But as we're going through the structures of the ribs and the sternum, where the blood is actually manufactured on people as we're getting older, it stimulates stem cell production. It's a wonderful thing. What do stem cells do? They're the cells that actually go in as juvenile multidifferential cells that are capable of functioning at a very high level and becoming the normal tissue, so it can repair damaged tissue with its own type of tissue cell. So that's the exciting part. It also creates a new blood supply called angiogenesis through all the research, and this is research that's going back since 1967, 68. There's lots of it around right now. So our proposal was that, if it works so well in other tissue and doing all of these things, why could it not work for, coronary tissue as well? So we decided that, as we're shining the light through the chest wall, to see what benefit you were getting. And it's obviously been doing well. I mean, have you seen your cardiologist since?
I saw him almost, I guess, a week ago.
And what was his comment? Or what?
He couldn't believe it. He said, what are you doing here?
I bet you.
Yeah, he was thrilled to death.
Mm-hmm.
Actually grabbed me, gave me a hug.
It was great.
Yeah, it was kind of neat.
And you've been seeing your cardiologist, the same fellow for years now.
40 years.
Wonderful.
40 years.
I guess you want to say who your cardiologist is?
Stuart Klein is my cardiologist.
Wonderful. Yeah. Heard a lot about him actually. North York General Hospital.
Yes, excellent doctor.
Well,
and
because he's the one that suggested, and you said, what can I do? And you said, well, my cousin's been bugging me about the laser. What do you think? And he said, well, you've got nothing to lose.
Absolutely. He said, what have you got to lose? That was it.
Yeah, exactly.
And here I am. I mean, I'm playing golf.
Really?
Yeah.
Good for you. That's great.
Yeah, it's unbelievable.
Yeah. Well, this whole thing about the fishing and other things, I noticed you were having a lot of trouble giving you handshakes and things a little while ago with your wrist. You fractured your wrist, and how's that been going?
Both wrists are fractured.
Mm-hmm.
And
how'd you do that?
Fell off the roof.
How many years ago?
It's got to be 5 or 6 years now. Oh, more than that. It's been 8 years.
So more in my professional, constructs, I was saying to you, use the laser on your wrists. And
well,
so
this one they put a steel plate in.
Yes. Yeah.
And they wanted to put a steel plate in this wrist, and that would have left me totally, because they're both bent the same way now in my head, but this one doesn't bend. I was in big trouble if they were both like that.
And remember, how's your hand grasp now? I mean, you couldn't squeeze that.
It's fine. The only problem is I can't hug my wife. Can't get my arm around. I have to hug her left hand.
Hey, it's one hand still good and works.
But
That's
this
amazing.
one, which is still broken, and it will not heal.
Yep.
I treat that with the cold laser, and from wearing a brace for 8 years, I couldn't move it. Now it's just like.
So, and you've been exercising now too, you were telling me, so that what has happened with your stamina and your strength, your upper body strength, that sort of thing?
I've got muscles. I even got pecs and abs again.
Wonderful. That's great.
And that's only in the last 6 months I've started that. I felt well enough to exercise, and I do a lot of isometric exercising.
Good. That's excellent.
It's amazing how muscles against muscles
can move, actually.
Can bring you back.
Absolutely.
Because it rebuilds the atrophied, your muscle atrophies. You of course know that.
Well, I certainly see a difference in you. I mean, you've lost your pear shape. You're getting your upper body strength back again, and it looks good. Absolutely.
I've gone from a 38-inch waist to a 34-inch waist. So
It's amazing. Wonderful.
that's
Wow.
just sitting in a chair exercising.
Well, I can remember when I went to see you at home before we started the laser that you were having difficulty just walking from your chair into the kitchen or to the washroom facility.
Exactly.
Yeah, you're out of breath and everything. So,
I couldn't do it. No.
well, I'm very pleased to see how you've come, and I'm sure that we'd like to see a bit more going on as far as studies in cardiology are concerned. So we're going to be looking into trying to find a group of cardiologists to do a future study for other people. I mean, it's one-off is good. I'm glad you've done so well, but we need to see this certainly be investigated more in a really professional way. Thank you.
Well, if I can add one thing, it's a shame that there are a lot of guys out there in my former shape
Yeah,
that are just sitting around waiting to die.
yes, it's
I mean,
tragic. Yeah,
as I said at the time, it's worth a try. I mean,
that's right.
what have I got to lose?
Well,
Well, here I am, and I think that's, for me, that's giving me my life back.
absolutely. And what has it saved our society? We were talking about how Jerry was prior to invoking the laser therapy, and he was spending probably 3 to 5 days in hospital, almost weekly for 8 months preceding the use of the laser. How many times have you been back since?
I went in briefly once because I had forgotten to take medications and I had overdone it. I was out working in the yard and
Right.
wheeling wheelbarrows and stuff, and it was just a goof on my part.
Right.
But I went in, they looked at me and said, "Go home, you're fine."
Well, this is the thing, and I think we've saved, you've been able to save the system, probably hundreds of thousands of dollars, and there's another 18 months
Fortune.
that you didn't have to be in hospital. So
Yeah.
I think it's certainly worthwhile looking into. That we should do more studies, something that's on the efficacy of future non-invasive care, and I think that's the way we should go. And we're going to look into that seriously, so we can help some more people and save the system. A lot of grief. Absolutely.
Perfect.
Love to see you.
Now I
This
get
is
to
gonna do
hug.
well.
Now I get to hug.
Good
Thanks,
stuff.
thanks, Peter.
You're so welcome.